Thank you, Madam Chair, and thank you, Commissioner Bassett, for being here today. I've been very outspoken on the topic of the waste, fraud, and abuse that we've seen in the Medicaid non-emergency transportation system. I mean, this was something that Andrew Cuomo took away from counties, the dispatch of these non-emergency rides a few years ago, and handed over to these transportation brokers that have raked in millions and millions of taxpayer dollars because they figured out a long time ago that the longer the ride is, the more money they make. On top of that, we have issues with these taxi drivers that are, in some cases, driving hundreds of miles a day, especially in rural areas like mine, to transport one person to a doctor's appointment and being paid a lot of money for it. And on top of that, there's a lot of, I've been told by law enforcement that there are many reports of, for example, a taxi driver taking someone to an addiction treatment service and then stopping on the way back so they can buy illegal drugs on the street before taking them home. Also, I've heard reports directly from family members of cash bribes being paid to Medicaid recipients so that they can choose that driver next time around. And the bottom line is this thing is a failed mess, but these aren't just my words. In the MRT2 reforms in 2020, they identified this as a huge waste of taxpayer dollars and said that we need to reform it. And it was actually put into the 2020 budget. And as of this day, we've had nothing done. Still the same waste, fraud, and abuse. I still see these taxi drivers all over my district. We're paying taxi drivers $300 to $400 a day in some cases to transport one person. And yet we're paying about what, $150 a day for a skilled nursing facility to take care of our sick, frail elderly. So when are we going to stop this waste, fraud, and abuse? And why hasn't it been done yet?
I'm happy to take that one, Dr. Bassett. So you're absolutely correct that we are in the process of a massive reform of the non-emergency medical transportation and NEMT industry, growing out from MRT2. The hallmark reform, as part of that package of initiatives, was moving from what's called a transportation manager to a transportation broker. And what's critical about that transition is the broker is being put at risk for managing the totality of the suite of NEMT benefits that are currently provided in the Medicaid program. And by creating that alignment of risk, the broker now is incentivized to tamp down on fraud, waste, and abuse. That process, we are very close to engaging the broker and moving to that model. We expect it to happen in the fall of this year. It's been a very massive procurement and moving to that structure. And we've collaborated closely with our partners at OMIG in building in the requirements in that broker contract to have advanced FWA detection and recovery systems. But there's now, and critically, there's going to be full alignment so that the broker is financially accountable for that fraud, waste, and abuse, which we agree was missing from the existing manager model. So it's a really great question. Yeah.
My time has expired. Thank you very much. And I appreciate, let me also just say quickly that I realize this was not on either one of your watches. So I appreciate that you're addressing it. Thank you.
Yep. Thank you.